um, thinking or are you asking yourself, ano ba talaga itong therapy, ABA therapy na ito? Okay, so today, I'm going to give you the introduction of ABA therapy kasi medyo broad, medyo mahaba, malawak po ang topic ng ABA. Actually, ako nung in-enroll ko itong course na to, it's 1 month po itong parent ABA training ko na ito. 1 month po ito ginawa or more than a month. More than a month po siya. Na modules din siya. And now I'm trying to make it like parang i-concise ko siya. I don't know how na I'm going to make it shorter pero maibigay ko pa rin yung buong concept ng ABA therapy. Right? So let me start. All right. So ABA therapy. What is that? Applied behavior analysis. So from the term itself, behavior, we are dealing with behavior. And the purpose of ABA is to decrease maladaptive behaviors. So what they do, this therapy is to improve the skills of your child and decrease problematic behavior. And it is built on the concept of rewards. Okay, so reward system ang ABA therapy. So can you do this, parent? Are you excited? How do I start with ABA therapy? Siguro may idea kayo with speech, may idea kayo with OT, but ABA, how do I do this as a parent? Sabi nga, decrease maladaptive behavior. How can I do this? How can I decrease yung mga problematic behavior ng aking little one? Kaya ba? Kaya ba, parents? Sabi ng Autism Speaks, they explain that parents are part of an ABA team actually. And they play a great role, especially in the amount of learning time a child has access to, meaning the child is with the parent or at home 24/7. Okay, as what we are always telling our little ones will be with our therapist 1 to 2 hours only per day or 2 times a week, 3 times a week. And the rest of the time, the rest of the days, they will be with their parents at home. So this is the great role of the parent. They have full-time access with their little one. And when parents get involved, kids learn faster. Diba? So, I just want to give you this inspiration. Sa umagang ito, it says, trust yourself. You are the parent. Remember that. Right? So, kung medyo nag-aalangan tayo, ano ba yung ABA na yan? Parang naririnig ko, it's complicated, it's mahirap siya, but then, meron bang mahirap para sa isang parent? Walang mahirap para sa isang parent na nagmamahal ng kanyang little one. Right, so let's move on. What are the things that we need to consider when applying ABA at home? Ano ba yung mga importanteng dapat kong i-consider? Three things to consider when applying ABA at home. Oh, you see, your skill, your style, and your life. What does it mean? Your skill. Okay, what skill do we need in dealing with our little one? Do you know what? It's patience. Patience is needed in dealing with our little one. Okay? So, example of this is a therapist is quite comfortable in repeating lessons 10 to 15 times. That's their job. They do their lessons, they prompt our little ones 10 to 15 times. All right? The question is, how about you? Are you ready to do this? Are you ready to repeat lessons? Are you ready to play with your little one 10 to 15 times a day? Right? So this is the skill that you need, the patience, because our ABA therapists, they have this character. They are patient, right? Number two, your style. What do you mean by this? Some therapists, they use a smile to reinforce a child. Sabi nga natin, mabuti pa yung little one ko nakikinig sa kanyang therapist. Sumusunod sa therapist. But sa atin as parents, parang ang hirap nilang mapasunod. Okay? Hirap silang mapasunod. What do we do para sumunod sila sa atin? Okay? Do we give food? Or do we give their toy? Do we give the gadget? Do we increase the screen time right away para sila sumunod? Kaya nga sabi dito, your style. Kasi yung style ng therapist, smile pa lang napapasunod na nila. Simple hug, napapasunod na nila. How about us? What's your style? The next one is your life. What does it mean? Our life as a parent. Ano ba yung life ng parent? We have difficult moments. Tama ba? Meron tayong mga difficult moments, meron tayong mga bad moments, right? Meron tayong mga loaded yung time natin. Umaga pa lang, household chores, pagod ka na, hindi mo na kayang intindihin o turuan si little one. Kaya nga kasama siya sa dapat i-consider your life. So, you should plan when do you intend to apply your lessons. Of course, do it when you have your good moment. Kasi pag bad moment ka or nagturo ka or nag-apply ka ng ABA therapy mo during yung time na pagod ka, during yung time na galit ka, during yung time na bad yung moment mo, then your teaching will be affected. So, kailangan i-plan mo na ahead. O sa umaga, ang dami kong trabaho. So, adjust. Kailan ba? Kung 8 to 10, ang daming trabaho, then maybe mga late afternoon kayo magsisimula ni little one. Right? Or, sa gabi, hindi ko na kayang turuan si little one kasi pagod na ako. Wala na akong energy sa gabi. So, plan ahead. Kailan kayo mag-aaral? Kailan kayo magle-lesson? Kailan kayo mag-play ni little one? Right? I hope nakuha po natin yung ibig sabihin. Okay, so these are the 3 important things that we need to consider when applying ABA at home. Your skills, your style, and your life. Okay, let's move on. So, how do we use ABA at home? Do you have any idea? Paano ba yung ginagawa ng ABA? At paano ko ito i-apply sa bahay? As we can see, we have 5 points here. how to use ABA at home. Pwede sa conversation ninyo ni little one. Pwede dun sa cognition niya. Ibig sabihin yung learning niya, yung listening niya, yung reasoning niya. Okay? Kung paano niya iniintindi ang mga bagay-bagay. Pwedeng doon pumasok yung ABA natin. Modeling. Ano ba to? Rewards. Ano ba to? And chaining. Okay, let's explain one by one. Conversation. How to use ABA therapy in conversation. Okay, at mealtime na lang, example. Give your child a bowl of food without a spoon. And then, prompt your child to ask for a spoon before you give it to them. Yan. Kung kailangan niya ng spoon, sabihin mo, okay, what do you want? Kailangan magsalita siya, kailangan sabihin niya na kailangan niya ng spoon. I need a spoon bago niyo siya bigyan. Okay, how about naman dun sa mga non-verbal? As we have said, hindi lang words yung way of communication. They can also communicate through gestures. Okay? So they can communicate through gestures. Okay? And before they do that, don't give yung kanilang gusto o yung kanilang kailangan. Okay? So that's ABA. Incorporate ABA in your conversation. Number 2, cognition. Okay, example naman ito. Ask your child to name the color of his shirt before you put them on. Yan. So, ititest mo yung cognition niya, yung cognitive skills niya. Okay, so bago nyo isuot yung kanyang t-shirt, or kanyang shorts, or kanyang cap, or anything, ask the color. Okay? How about if my little one is non-verbal? Okay, dito na ngayon papasok yung patience na sinasabi ko. You do it again and again and again, 10 to 15 times. Or 1 week, gawin mo yan ng tuloy-tuloy. 1 month, 2 months, 3 months. Okay? Dito natin sila tuturuan paano magsasalita, paano magsalita, and paano natin i-incorporate yung ABA therapy through cognition. So kasama dito yung patience natin. Right? Do it over and over again. And soon, matututo na. Kahit sa gestures lang, kahit yung pakonti-konting words or sounds, later on, matututo yung ating mga little one. Okay, let's go to modeling. What is this modeling? Example, if you ask your child to do something, but it seems unclear, parang hindi niya naintindihan, parang unclear yung instruction mo. So what you are going to do, use your hands to tell it. Okay? I-model mo kung ano yung gusto mong sabihin. Example, you ask him to pour the water in his cup, but he doesn't understand. So, i-model mo. Paano ba maglagay ng water, mag-pour ng water sa cup? So, i-model mo yon at gagayahin mo yun. Let him do it. Right? Or you can grab his hands, i-model mo kung paano yung gagawin. And the next day, next time, let him do it. Right? Next, rewards. Okay. As we have said, yung ABA is a reward system. So what do we do here? If you give a prompt and he followed it at once, give a reward. Ayun. Pag nag-follow siya agad-agad, reward din agad-agad. Okay, what are the reward? It can be a smile. It can be a hug, a snack, right? So yun yung mga reward natin sa kanya. Or additional 30 minutes screen time, right? So the more he experiences an action followed by a reward, the more he will follow. Sa susunod, follow na siya. Sa susunod, alam niya na, gawin ko na yung task para may reward ako. Okay? Next is chaining. What is this chaining all about? So, some tasks are complex. Diba? Medyo mahirap. Medyo hindi nila maintindihan. Medyo hindi nila mag-gets. Dahil parang ang dami ng task, ang dami ng procedure. So, they may not understand it. So, what we're gonna do is, we can use visual aids or yung mga PECs, diba? And explain the link from one task to another. Okay? So yung link or kung ano yung connection from one task to another. Like, for example, yung shampooing ng hair. So ito we need to do. O, diba? Wet hair muna. And then next is apply ng shampoo. Next is i-rinse. And the last one is i-dry yung hair. Right? So, kailangan chaining. Okay? Kasi yung mga task sometimes is complex at hindi nila maintindihan. Okay? That means sprinkle the task throughout the day. It doesn't have to be at one time. Pwedeng i-divide, chunk mo yung mga steps or yung mga to-do niya during the day. Okay? And make sure to keep track of your child's responses. Yan. Dapat tinitake note mo din kung ano yung response niya from one task to the other. Okay? So, that means diary making is still applicable here. Okay? So, keep your diary going. Always my notebook sa tabi. Right? What else? Okay, now we discuss about the don'ts of ABA therapy. Ano yung mga don't ng ABA therapy? Alright. Sabi dito, don't punish and don't stop. Ano ba to? Okay, as we have said, ABA is reward system. No punishment is required. Okay? So, if you feel irritated or angry or depressed or wala ka sa mood, okay? Lalong-lalo na if your child doesn't do as they are told, anong gagawin? Back off. Back off bago mapulot yung pamalo. Back off bago mo masigawan si little one. Back off na. Take a break and come back later. Okay? Pwedeng ulitin nyo ulit mamaya. Okay? Kung hindi niya na-gets, hindi niya ginagawa, maybe pagod din siya, nagtatantrum siya, back off. Baka pareho kayong pagod na. Okay? You can take a break and you can come back later dun sa task. What else? Don't stop. What's the meaning of this? Don't stop even you don't see changes. Kaya nga, be patient. One time mo palang tinuruan, napagod ka na or sumuko ka na. Sabi sa ABA, don't stop. It's not quick. It's not an overnight success. Just keep working and growing. Okay? Keep working and growing. And your child will do the same too. Right? So, I hope you get something out of that. Don't punish and don't stop. Okay? And look for ways to apply the techniques you are learning in as many settings as above. Kanina nga, 5 yung pinag-usapan natin. Conversation, cognition, reward system, modeling, at saka yung training. Huwag tayong limitahan dun sa 5 bagay lang ngayon. Look for ways to apply the techniques that you are learning in as many settings as possible. Grab every opportunity para magawa mo itong ABA therapy at home. Okay? But let me just leave you with this phrase. As a parent who wants to learn ABA therapy, first and foremost, you should understand is, okay? So, andito na tayo sa ABA therapy. This is included in your program to learn the steps or to learn the concept of ABA therapy and how do you implement this. First and foremost, you should understand that, sabi dito, behavior is maintained by its consequences and influenced by its antecedent. Okay, ulitin ko siya. Behavior is maintained by its consequences and influenced by its antecedent. Parang mahirap siyang intindihan, di ba? So, behavior, consequences, antecedent. Okay, yung tatlong to, the A, the B, and the C. These are the ABC of ABA therapy. Okay, and I will see you on the next video for this. Bye.